digital health is very important, and also it will change our practice near future in daily life. But I will speak in Turkish from then on, and you may use, okay, I see your headphones. Benim konuşmam bugün.
Today I will be speaking about virtual reality applications as a psychosocial recovery tool in schizophrenia treatment, and in terms of recovery in schizophrenia treatment, whether we can use the virtual reality and the psychosocial functioning with schizophrenia is directly correlated with negative symptoms, and yet approved by the FDA to increase the psychosocial functioning in schizophrenia. There is yet no drug, and in this regard, we still need new technologies. And the virtual reality seems to be a promising agent or device for the future. What is virtual reality? Through goggles, it provides us an opportunity to experience the reality, and just through an interface, when you wear the goggles, it makes you feel as if you are experiencing or living that reality. I don't know whether any of you have experienced this, but actually this is a really important technology, and it's developing recently. And the field where the virtual reality, we can just make us it's like just the recent past of the cell phones, for example. But now we have the smartphones with us, and we can access any field, any platform we like. But what I would foresee, within 10 years, perhaps we will be wearing the goggles, and we will throw out these smartphones into the bin, perhaps. And many of the institutions working in the field of technology, they're trying to produce such goggles. And the goggles existing for the time being are rather big ones. And in time, they are getting smaller, and they are not very commonly used, and they're expensive. But the greatest problem is about the ethics, because through such a goggle, you can get a recording of many of the things that you see in your daily life. The virtual reality is when it was used in the field of schizophrenia, there was a big reaction, because it was said that these schizophrenic patients are experiencing a confusion in their lives, whether this would not cause any confusion further. And this didn't happen, so because the people who wear these goggles actually showed some improvements, and psychotic attack did not take place, but because of diagnosis or for treatment, it started to be used commonly. And the most important the most common side effect, that it causes a kind of nausea, as if, for example, when a person gets on the vehicle, it's kind of motion sickness. So this might be one of the side effects. And this is a study that includes the cognitive functions in schizophrenia. And it's a serious game to improve. What happens is that a person is assigned to some certain homeworks, and then the person is directed to or given some instructions to go somewhere or do something. So it is trying to be found out whether it has an impact of improvement or not. We also have a systematic study as for the virtual reality interventions as psychosocial functioning in schizophrenia spectrum disorders as a systematic review. What we identified is that the virtual reality applications for the time being do not show any characteristics to improve the schizophrenia. However, related with the virtual reality applications, there are many approaches, like the scales, for example, as well as many sessions. So these differences as well would make any interpretation about it. So this is from This is with my doctorate degree student. It's a study I carried out with her. So it's about whether we could improve the psychosocial functional disability or disorder in these schizophrenic patients. And I presented early in another congress. And actually 114 people were involved in this, but the number of the patients was 37 who were found to be eligible for this study. And in one group we have the virtual reality application, and the other one with the other group we had a meeting weekly. And also the virtual reality group had the interview or the application weekly as well. So this is the Golf Probe Fusion 360 degrees virtual reality images, and also the voice system. So these Googles are used for this, and so far with the VR applications, different than the EVR applications up to now, these are the videos that are real individuals related to their daily lives, real daily lives. And also most of the time, in the virtual reality, there are the animation type of applications. However, or nevertheless, the real daily activities of the people, individuals, were also shown. And the challenge of this study was that there was a control group in this study. And you see different scenes here. For example, a cafeteria or cafe, and a person goes there and then talks with the bartender and then orders a coffee. And also tramway, for example, and also you see a market here in another session, and then visit to a home, for example, a social environment was presented for this person to participate. And we see the comparison of social demographic variables here. And in both of the groups, between the both of the groups, at the beginning, there was no significant difference. And some of the volunteers could not accomplish the study. And related to the ones who accomplished the study from the perspective of both of the groups, there has been no statistical significance was identified. So the sociographic features of the virtual reality were similar to the real group or the control group. And also the number scores were the same. And you see the first results with the psychosocial functionality of the patients were evaluated. Especially one of them is about the psychosocial functionality scale, and the other one is social functionality. And here it's about the self-report scale. And when we look in both of these scales, in both the control and the virtual reality group, we haven't seen any difference. And in terms of the social functionality, we see that the control group is rather improved or increased more. And this is one of the attention drawing thing, is that the psychosocial functionality is increased here. And in both of the groups, there is no difference. However, the schizophrenia patients who were included in this study, both in the virtual reality as well as within the interview that was carried out weekly, we see that there is an increase in the improvement of the disease, but it didn't continue. This study did not continue. And in terms of the PANS scores, there's no difference in terms of virtual reality application. In both the virtual reality as well as the control group, the PANS scores, in negative scores, there have been a clear indication of the decrease in the scores. So once again, when we look into the as a result of the follow-up for 3 months, we see that in both of the groups, the identified improvement has continued, but there was no significant difference in between the groups. When then in the virtual reality, what was the predictors for increase in the scores in terms of the PANS total, pause, and negative scores, and in terms of the mindset theory, and we haven't identified any correlation. And In the recent time, there is also a concept that emerged recently in the virtual reality. This is while the individual is experiencing the virtual reality, to which extent he or she is involved in that, where can measure this. And there are 5 subscales here, and in each scale here we see that until the 12th week, we see that there's a clear and specific improvement. In the first 2 weeks, we see that the virtual reality goggles are adapted in patients, and there are rather relaxation sessions. So for that, we can roughly say that there are in total 10 sessions, and this is a different finding, and especially the patients with negative symptoms, the sense of presence during VR session in patients with schizophrenia is rather lower. And then so far that for the first time this has been shown with such an experiment. And as a result, as a conclusion, we can say that in the study that we have carried out, there is no significant differences between the virtual reality and the control groups regarding improvement in psychosocial functioning. However, there has been identified a significant improvement of psychosocial functioning in both study groups. And since there is no relation between psychosocial improvement and PANSS total, positive and negative symptoms, neurocognitive functions, and social cognition, and Köksal theory of mind in virtual group. So especially the sense of presence could be predicted, which would impact the study directly, the output of the study directly, and accordingly the method needs to be reorganized. And thank you very much for your listening. And these are the supporting organizations, and this is the team of TÜBİTAK from Köksal University Virtual Reality Group, and also this is Ilgun, my colleague, who we carried out this project together, and also the patient participating at psychosocial functioning tests here. Thank you.